Welcome, future nurses. Today, we're mastering the complex world of acid base imbalances. To understand imbalances, we must remember the body's tightrope, a normal pH of 7.35 to 7.45. When pH drops below 7.35, we enter acidosis. Let's start with the lungs, respiratory acidosis. This occurs when the respiratory tract is depressed, causing CO2 to be retained in the body. Causes include anesthesia, opioid overdose, or increased intracranial pressure, any condition that slows breathing. It also happens when gas exchange is blocked, like in pneumonia, COPD, or a pulmonary embolism. Look for muscle weakness, drowsiness, or even a coma. Watch those heart rhythms and blood pressure. Your interventions: assess the breath, provide oxygen, and place the patient in semi-Fowler's position. Crucial tip: never give sedatives or opioids. They will only depress the respiratory system further. Now, let's flip it. Respiratory alkalosis happens when we blow off too much CO2 through hyperventilation. Fever, pain, or even a mechanical ventilator set too high can trigger this state. Alkalosis causes calcium to bind to albumin. This drop in free calcium leads to tetany and muscle spasms. Calm your patient. Encourage slow breaths or even breathing into a paper bag to re-inhale that CO2. Moving to the metabolic side, metabolic acidosis is about the kidneys and the gut. In diabetic ketoacidosis, the body burns fat instead of sugar, releasing acidic ketones into the blood. Remember, diarrhea means losing alkaline secretions from the gut, leaving the body in an acidic state. The lungs try to help. Watch for Kussmaul respirations, deep, rapid breathing to blow off excess acid. Treat the cause. For DKA, it's insulin and fluids. For renal failure, it's dialysis to clear the waste. Finally, metabolic alkalosis. Think of this as losing too much acid or gaining too much base. Vomiting or NG suction removes stomach acid, which is high in chloride, making the body alkaline. Even massive blood transfusions can cause this, as citrate in stored blood converts into bicarbonate. Understanding these internal shifts is key to nursing care. Keep monitoring those ABGs and electrolytes.